and the science from feelings. What does the actual evidence show, Dr. Joan Ritho? What does it show and what does it say about cannabis in cancer care? You talked about relieving those symptoms. What is the evidence that you have seen so far? And where does the evidence begin and where does the hype also begin or end?
Thank you for that question. So first of all, we have to understand that there's no scientific data that shows that cannabis can cure cancer. So what the data is available is it helps with the symptoms associated with chemotherapy. So, and the symptoms that we see are anxiety, depression, nausea, vomiting, weight loss, all those symptoms. And the data that we have that's the strongest, it is the anti-nausea and stimulation of appetite. You see a lot of patients lose a lot of weight. So this is where they have good data. There's also some data when it comes to pain, and that's the much of it. But curing cancer, there's not a lot of it. All they've done is looked at a cell in a dish, and of course, if you put anything, bleach or cannabis or anything, it will kill cancer cells. So what needs to be done is take those scientific data and do clinical trials. That has not been done. So that's where the science, that's the limit of the science.
So that's the science, but then it's a holy hub in Rastafarian, and you've talked about how it gives you relief and how you use it for different things. Maybe just take us through how exactly you use it in different forms.
So no, in cannabis as a plant as a whole, it have roots, it have branches, it have leaves, and it have stalks. So in cannabis, wherever they are fighting in Kenya, is the psychoactive part of it. And the chemical there is tetrahydrocannabinol, the THC.
Yes.
And in our system, we have the endocannabinol receptors. So in a medical, the seeds, when I soak at night in the water and I blend in the morning, it produces hemp milk. Now hemp milk has omega-3, omega-6, omega-9, and omega-12.
Yes.
So it's very good for children who have the problem of mental stability. Again, it has a very good roughage system because the seed, a country like Nepal, nothing grows there.
Yes.
They use the seeds, is TH-free. The leaves are TH-free. Nothing good chlorophyll in the world like of cannabis leaves. We know even the chemical matrix formula of chlorophyll is next to hemoglobin. The science now is saying that. Now ancestors were using for that. The roots are good to relieve pain and the joints problem. Again, they are TH-free. You see, as Rastafarian, we take as a holy herb because it provides us toll. Another side, when now you mature at the age, you can use it now, the little THC, because it has around 85 synergic level chemical of spirituality. So it tap in different frequency depending the vibration and frequency you behold.
Yes.